Namaste. Shri Gurubhyo Namaha. Jnananandamayam Devam Nirmalam Spatikakritim Adharam Sarvavidyanam Hayagrivam Upasmahe. Athataha Dirghan Jivitiyam Adhyayam Vyakhyasyaamaha iti hasmaha Bhagavan Atreyaha. Athataha Gulma Chikitsitam Adhyayam Vyakhyasyaamaha iti hasmaha Bhagavan Atreyaha. अद्य कथा प्रसक्ति ही किंचित पूर्वकथा प्रमेय अनुवादः. Gulma, we were studying in the previous session and we understood that how doshaja gulma causes due to its dosha vikriti, dosha prakopa, and prakupita dosha leading to various sorts of gulma conditions. And we also tried to understand what other sorts of clinical importance to the present era in respect with something called as various GI related disorders, which starts from mukha and up to Arbuda, wherein we also try to elaborate about mukhagata vikaras and guda up to guda paryanta aneka vikara we have tried to gather. Now in continuation we will see how the gulma is originated with special reference to Dvandvaja gulma. Nimitta lingan upalabhya gulme dvidoshaje dosha balabalam cha vyamishra linganu paramstu gulmam strinadi shed aushadha kalpanartham. So, Vyamishra Lingaha, that is Dvandvaja Gulma, Vata Pittaja, Vata Kafaja, Kafavataja, Rakta Vataja, Tatha Aneka Vidhaha Vyamishra Lingaha. When Rakta involvement is understood, it is basically in respect with that of Stri only, where Purusha can be excluded for its understanding, because Raktaja Gulma can be seen in Stri only due to the presence of Arva. That all we know. But can we understand that Rakta being a Dhatu, so Raktaja Gulma can be seen even in Purusha and such clinical scenarios? Now what we can understand is various clinical conditions where blood is directly involved with dosha can be considered for Raktaja Gulma. Gulma is Pindakara that we understood in the previous sessions. Now we can understand inflammatory signs with bleeding tendency as Gulma only. Arsha can also be grouped under a subcategory heading of Gulma itself. Hence, Raktaja Gulma in that fashion can be understood even for males. Nimitta lingan upalabhya gulme dvidoshaje dosha balabalam cha. What all the nidana have been explained for the dosha prakopa, if they are clubbed, may it be swatantra or paratantraja, then that type of mixture of two dosha lakshana and nidana and samprapti leading to combined features can be understood as Dvidoshaja or Dvandvaja Gulma. Vyamishra Linganu Paramstu Gulma Striyanadishet. Three types of Gulma can be seen in Purusha, that is Vata Pittaja, Vata Kafaja, Kafa Pittaja Gulma, and Rakta related, Raktaja Gulma should not be considered in case of Vyamishra Linga, that is Dvandvaja Gulma, that is what Granthakara says, because you cannot give uniform or universal presence of such type of gulma. So hence when we are explaining, when the grantha is being explained for a universal truth, so in that condition raktaja gulma or rakta being involved in the dvandvaja gulma should be contraindicated, or it should not be considered. It is confined only to stri. That's what Granthakara says. Maharujam दाह परीतमश्मं वद्धनो अन्नतम उन्नतं शीघ्र विदाहि दारुणं मनश्शरीराग्निबलापहारिणं त्रिदोषजं गुल्म साध्यमादिशेत्. Gulmam asadhyam adishet. So Granthakara further says that Tridoshaja Gulma becomes asadhya. Why? Maharujam. This will be always confined with Tivra Vedana. Maharujaha. Daha Paritam Ashmam Avadhanam Unnatam. Unnata is Atyanta Vruddha and Shigra Vidahi Dharunam. We can think about various acute or chronic clinical conditions to understand in a better way to the present era. For example, we can understand about various cancerous conditions as a gulma, as well as tubercular intestinal pathologies. Mukha to Guda, tuberculosis can exist at any part of the organ or the system, that is GI, and we can definitely think about gulma avastha in all these clinical conditions. Maharujam shigra vidahi darunam. Daruna Vedana, that is Tivra Vedana. Manasharira Agni Balapa Harinam. Manobala Agnibala Sharira Bala Apaharinam. It takes away the bala of individual. Such gulma is called Tridoshajam, and this Tridoshaja gulma is always asadhya. This is what Granthakara says. Ashmavad Unnatam. Ashmavad Unnatam means Ashma is stone. Stony, hard type of gulmaja conditions are usually preferred or understood in case of cancerous pathologies. Hence, Tridoshaja gulma can go its inclination towards cancerous pathologies of the GI system, and all the organs related with the GI system can be grouped and clubbed under the Tridoshaja gulma itself. And as the cancerous growth is appearing very hard, so similarly the gulma lakshana explained for Tridoshaja gulma in it can be to some extent can be thought in respect with cancer. Hence Tridoshaja gulma becomes asadhya. Then the question immediately arises in everyone's mind that Arbuda is explained as a separate entity. Then why did Granthakaras did not explain Arbuda in gulma itself, where Arbuda is or Karkaroga Prakarana explained by Madhyakalina Granthakaras and other acharyas? Why didn't they include in gulma? The thought is definitely true, but it is, as previously said, we need to have a broad-minded or broad sense of understanding the hidden meanings of the Granthokta Vakya, and the Grantha is written in that fashion itself. We need to understand it in a the way it is taught or the way it is written. So we are unable, hence we think it is not explained, but it is definitely explained. Now for Arbuda, what is Vyakhyana given by Acharya Sushruta is Gatra Pradeshe Kochideva Dosha Sammurchito Mamsam Abhipradushya Vrittam Sthiram Mandaruja Mahantam Analpamulam Chiravridhya Pakam Kurvantu Mamsopachayam Tushofam Tamarbudam Shastra Vido Vadanti. So Gatra is Sharira. Gatrasya Pradeshaha. That means one or the other part of the body. Gatra Pradeshe Kvachit Eva Doshaha. Without dosha, Vyadhi never takes place. Hence, Kvachit Dosha, Kaunshchit Dosha, when they are Prakupita or Vikrita, Kvachideva Dosha, Sammurchitaha Mamsam. Mausena sammurshitha. It lodges its pathology in the Mausa dhatu, and Vikara starts at Mausa dhatu. Sammurjito Mamsam Abhipradusha. Entering into the Mausa dhatu or Mausa dravya, it creates Vikriti of the Swasthana Sthita dosha, and there the Vyadhi starts originating. Mausam Abhipradusha. What it turns? Vrittam, ovular, sthiram, fixed, mandaruja, associated with mild dull aching type of pain where the patient neglects. Mandaruja, mahantam, maranam eva mahantam, it has a big end story or big end movie, that is the death can be considered. Mahantam, vrittam, sthiram, mandaruja, mahantam, analpamulam, it has multiple roots feeding to it. When you touch any part of the Arbuda, it bleeds heavily. Vrittam, sthiram, mandaruja, mahantam, analpamulam, chiravriddhihi, it grows slowly it grows. Chiravriddhihi, apakam, chiravriddhi apakam, it never undergoes putrefaction where the pus is not seen. If it is converting or if the pus is formed, then that can be drained out and it can be cured. But when there is no pus formation but still the growth is continuing, then that is usually a karkaroga or arbudavat vyadhi. Chiravriddhi apakam kurvantu mamsa upachayam. Mamsa upachaya is sangraha. Upachaya is add that particular area of that the Mausa dhatu or organ, there will be vruddhi of this particular doshaja lakshana. Kurvantu mamsa upachayam to shofam. Shofa is swelling or a sort of vruddhi. Shofam. Tam, for this, Shastrakara or Jnani, Shastriya Vaidya, they say, Tam Arbudam Shastra Vido Vadanti. Shastra says ki this is Arbuda. So can we consider the Samprapti of Arbuda is going in hand with that of Gulma Roga itself. Hence, Gulma could be a type of or cancer could be a part and parcel of Tridoshaja Gulma. Further, ऋतु अवनाह आहारतया भयेन विरूक्षणैर्वेग विनिग्रहैश्च संस्तंभनोल्लेखन योनिदोषैः गुल्मः स्त्रियं रक्तभवो अभ्युपैति यस्पन्दते पिण्डित एव नाङ्गैश्चिरात् सशूलः समगर्भलिङ्गः सरौधिरस्त्रीभव एव गुल्मो मासे व्यतीते दशमे चिकित्स्यः. Granthakara further continues and says ki Raktaja Gulma. How Raktaja Gulma is caused? Rutukale Rutava Anaharataya. If Bhojana is Tyajita during Rutu, if someone does Tyaga of Bhojana during Rutu Kala, Rutu anaharataya bhayena virukshane, due to bhaya and virukshanaihi vega vinigrahaihi. Virukshana is undergoing rukshana chikitsa. Rukshana chikitsa or rukshana vidhi is keeping yourself without food is a type of rukshana, or having food where there is no snigdhamsha is also virukshanam, or atyanta atapasevanam, or ativa jalasnanam ityadi. Snana is always rukshakaraka. Vinigrahaishcha, vega vinigrahaishcha, vega dharanat, samstambana ullekhana yoni doshaihi. Samstambana is raktasthambaka ahara dravya during the rutukala or masika artavasrava. In that condition, if the individual consumes the ahara which is more of raktasthambaka dravya, like kashaya rasa, if the stree consumes more during artava kala or rutukala, then that kashaya rasa by swabhava is thambaka. It does thambana of the doshas. When the raktasthambana takes place, that sthambita rakta gets converted. Samprapti is again the same. Wherever there is avarodha for the marga, then the dosha starts revolving there and there and there. It forms a big mass. Samstambana ullekhana yoni dosho gulmaha striyam rakta bhavo abhyupaiti. So this is caused due to the Rakta itself, and hence it is named as Raktaja Gulma. And its Lakshana are Yas Pandate Pindita Eva Nangaish Chirat Sashulaha Samagarbha Lingaha Saraudhira Stri Bhava Eva Gulmo Mase Vyatite Dashame Chikitsyaha. So Yaha Spandate, Yaha is this Raktaja Gulma, is Spandate, it is pulsatile in nature, and due to its pulsatile nature, we think that there could be a garbha, and that being garbha or bhruna, if we try to evacuate it, it is a bhruna hatya mahadosha. Bhruna hatya mahadosha is a big dosha explained in Shastra Grantha. And in Trisuparna, you might be knowing Brahmahatyam va ete gnanti, Bhrunahatyam va ete gnanti. This Bhrunahatya is Mahadosha and it is Mahapataka Karaka. Hence, for that reason also it is said, even if the Raktaja Gulma is present and if it is having pulsatile features, then please maintain till the 10 months and then do chikitsa for the Raktaja Gulma was mentioned. But at present day, due to the availability of the scans, sonologies and all, we can understand what exactly the Vikriti going on into the Garbhashaya, and if it is not a Raktaja Gulma, if it is not a Bhruna, then you can start treatment immediately. That is what is the abhipraya of Granthakara. Then don't take a question that didn't the acharyas knew to examine whether it is Bhruna or Gulma. That all is a question of debate. Hence, Mase Vyatite Dashame, after 10 months, even if after the 10 months there doesn't takes place the delivery symptoms or the signs, then you may proceed for chikitsa of Raktaja Gulma. Sushrutacharya says to wait till 1 year, that is 12 masa, and then to treat such type of Raktaja Gulma. Kriyakramam atah siddham gulminam gulmanashanam pravakshyamyata urdhvam cha yogan gulma nibarhanan. So kriyakramaha, kriya is chikitsa, chikitsayaha kramam ataha siddham, siddha chikitsa krama for gulma, gulma nashanartha, whatever is needed, that the Granthakara is being narrating here. Pravakshyamyata urdhvam cha yogan gulma nibarhanan. Pravakshami cha urdhvam. Urdhvam is above explained clinical features, whatever is there. For all that, yogan gulma nibarhanam. Gulma nibarhanartha, all those clinical conditions, Raktaja Gulma, Dvandvaja Sannipataja Gulma, and Ekadoshaja Gulma, for all these clinical conditions, what all yoga can be made use, that is being narrated here in the future shlokas or verses. Ruksha vyayamajam gulmam vatikam tivra vedanam baddha vidmarutam snehaihi aditaha samupacharet. So Vata Gulma Chikitsa, he says that Ruksha, Vataja Gulma is origin, or the Vata Prakopa takes place because of Ruksha Vyayamajam Gulma. Ruksha and Vyayama, he is just giving one or two relative reasons for the Vata Prakopa. Ruksha, by this he is telling about the Ahara. Vyayama, he is telling about Vihara. Ruksha Vyayamajam Gulmam Vatikam Tivra Vedanam. Such Gulma is Vataja Gulma, and it is always associated with Tivra Vedana. Baddha Vindmarutam Snehaihi Aditaha Samupacharet. Baddha Vindmarutam. It is caused due to avarodha for the mala and apanavayu. Baddha Vindmarutam Snehaihi Aditaha Samupacharet. Adi, the chikitsa Adi Teva Sneha Prayogaha. So the chikitsa begins with the Sneha Prayoga in case of Vataja Gulma, and hence in Vataja Gulma Sneha Chikitsa should be initiated. Bhojanabhyanjanaihi panaihi niruhaihi sa anuvasanaihi. Bhojana, Abhyanga and Pana all must be with Snigdha Guna. Then Panaihi, Niruhaihi sa Anuvasanaihi. Anuvasana Purvas Niruhavasti can be made use for the Shamana of Prakupita Vayu. Snigdhasya Bhishaja Svedaha Kartavya Gulma Shantaye. Snigdhasya Bhishaja. Bhishak is Vaidya. Bhishaja is Aushadha. Here Aushadha and Bheshaja, two different terminologies. These two different terminologies are being explained by Kashyapacharya in Indriyasthana 11th chapter. Only one chapter is available. Please go through with it. What is the difference between the word Aushadha and Bheshaja? Once you know about this, once you know the difference of Bheshaja and Aushadha, you may not be able to use both the words in a similar context where you need to use the word Aushadha and where you need to use the word Bheshaja can be discriminated. Please go through with Kashyapa Samhita, Indriyasthan, 11th chapter, where the meanings of Aushadha and Bheshaja in the beginning, 4th or 5th verse, I think, they have been given, and please consider it. Now here the word Bhishaja. Snigdhasya Bhishaja Svedaha Kartavyo Gulma Shantaye. Snehana and Svedana becomes the prime chikitsa sutra for the Gulma Shanti, that is particularly Vataja Gulma. Srotasam Mardavam Kratva. Why Vataja Gulma was originated? Because of Ruksha Guna Vruddhi in the Mahasrotas, Mukha to Uda. There the Prakupita Vayu while doing Sanchara had a hindrance or avarodha due to the Ruksha Guna Vruddhi. That is why the Gulma started originating. Now what is our idea? Our idea is to throw away the Vikrata Vayu. For that the Marga avarodha should be relieved, and this avarodha is caused due to the Rukshadi Guna Vruddhi. Hence Srotasam Rukshadi Guna Vruddhe Snehadi Gunam cha upayojayet. So Snigdhasya Srotasam Mardavam Kratva Jitva Marutamulbanam. When you do Sroto Snehana or Sroto Snigdhatva, when you attain, automatically there will be Sroto Snigdhata that will lead to Ulvana Ulvita Maruta Shamanartha. Jitva Bhitva Vibandham Snigdhasya Svedo Gulmam Apohati. So Bhitva is do Bhedana. Here you can make use of Kshariya Dravya or Bhedaniya Mahakashayadi Dravyas for along with Sneha, or Sneha which is Sadhita with Bhedaniya Kashaya. Yatha Saindhavadi Tailam Ghritam with Saindhava Lavanam, Hingu Sadhita Ghritam can be given as a Ahara and Aushadha for Gulma Shantyartham. Bhitva Chedya Tatra Kshananadva Ksharaha Chedya Bhedya Lekhya Karana Tridoshaghnatvat. So Mrudu Kshara can also be made use here. Vibandham Snigdhasya Svedo Gulmam Apohati. When you do Mala Bhedana, Mala Nissarana takes place. Once the Mala Nissarana is taking place, Srotas is clean, Avarodha is relieved. So Vikrata Dosha goes away, and that is how the Gulma Shanti takes place. Gulmam Apohati Snehapanam Hitam Gulme. In case of Gulma, Snehapana is Hita. Visheshen Urdhvanabhije. Visheshataha Urdhvanabhija Vataja Gulma. Snehapana is Atyanta Upakari. Pakvashaya Gate Bastihi Ubhayam Jatarashraye. In case of Pakvashaya, there can be Basti Chikitsa being utilized, and Basti Chikitsa can also be made use in both Pakvashaya Sthita as well as Jatarashaya Ashrita. Dipto Agnehe Agnau Vatike Gulme Vibandhe Anila Varchasaha. Deepto Agnau. Agni Deepana should be performed. Agni Deepana is improve the digestive capacity. Agni Deepanam. For Deepanartha, Laghu, Snigdhayukta, Sukhapachi, Ahara should be given. Yatha Anirastrana Goma Yadye Sandhukshamano Bhavati Kramena, which is explained in Siddhistan after Vamana Virechana for the Samsarjana Krama. The same fashion should be followed in case of Gulma Chikitsa so that the Agni Uttejana takes place. Bruhanani Annapanani Snigdoshnani Prayojayet. ब्रूहणानि अन्नपानानि स्निग्धोष्णानि च प्रयोजयेत्. Snigdha ushna brahmana anna should be utilized. That's what is said. Punah punah snehapanam nirohaha sa anuvasanaha. Punah punah snehapan. Here vicharana sneha can be considered for panartha if the patient is not willing for prakrita avarohana krami snehapana, then vicharana sneha can be made use, and prabhuta matra ghrata should be given along with the anna. Prayojya Vatagulmeshu kafapittanu rakshinaha. So when you are utilizing these dravya for the treatment of vata, you also must know that you are protecting the kapha as well as pitta while treating vataja vikrita. Kafo vate jitapraye pittam shonitameva va yadi kuppyati vatasya kriyamane chikitsate यथाल्बणस्य दोषस्य तत्र कार्यं विषग्जितम् आदावन्ते च मध्ये च मारुतं च परिरक्षताः. So what Granthakara says further is about kafe vate jitapraye pittam shonitameva va. What he says is, while doing chikitsa, kafo vate jitapraye pittam shonitameva va. While you are treating the gulma, that is vataja gulma, you must always protect for pitta as well as kapha and rakta also. Similarly, while treating other gulma, you are supposed to take care of the vayu if it is normal, but which is very rare to occur because the gulma vyadhi itself is vata pradhana. Without vata, gulma does not exist. But gulma, in case of other gulma, pittaja gulma, kaphaja gulma or dvandvaja gulma, where vayu is absent, or the lakshanataha vayu is absent, but the supta avastha vayu is doing its work and it is creating trouble, and it is the culprit for the utpatti of any type of gulma. Though pradhana lakshanaanurupi doshaja gulma are explained, but pradhanataha mukhyataha vata is always involved in any type of gulma vyadhi. Kafo vate jitapraye pittam shonitameva va yadi kupyati vatasya kriyamane chikitsitaha. While treating vataja gulma, if there is vikruti for these kapha, pitta as well as rakta, then those must be treated there and then only. Yatholbanasya doshasya tatra karyam vishagjidam. Whichever the dosha is getting ulbana, and there and then the Vaidya must treat for those dosha and control the prakopa of the other dosha while treating vataja gulma. Adavante cha madhye cha marutam parirakshataha. At the adi, madhya and anta of the chikitsa, you must think that vayu must be always protected and do not allow the vayu to have any type of prakopa. Prakopa here can be vruddhatmaka prakopa or kshayatmaka prakopa. Either of it, if the prakopa takes place in vayu, then there will be trouble which is going to occur in future, and the chikitsa may end with complications. That's what Granthakara said. Vatagulme kafo vruddhau hatva agnim aruchim yadi hrillasam gauravam tandra janayed ullikhettu tam. Vatagulme kafo vruddhau. Now vividha avastha Granthakara is explaining. Vatagulme kafo vruddhau. In case of vataja gulma, if while treatment or by the nidana sevana, if there is kapha vruddhi and hatva agnim aruchim yadi, there will be agninasha and agninasha leading to aruchi in such case, and hrillasam gauravam tandra janayed ullikhetutam. If there is hrillasa, anga gaurava, tandra, adi lakshana seen in case of vataja gulma where kapha is prakupita, there the chikitsa is beginning with vamana. This is the condition where sadhyavamana can be done. This is the condition where sadhyavamana can be done, because the ashukari vruddhi of kapha leading to prakopa and leading to the lakshana, it is a sort of avarana or anyonya avarana sambandha. Instead calling anyonya, it's a avarana dosha which is creating vikruti. Instead of vataja lakshana, now the kaphaja lakshanas are also seen. So to subside kapha there and then only, what he said in the previous, yatholvanasya doshasya tatra karyam bhishagjitam tattat karyam avashyaya kartum. So here while treating the vataja gulma, chikitsa would begin with snehana and anuvasana, niruha, etc. chikitsa. But there, if the kapha vruddhi is seen and if the kapha prakopa is seen, the chikitsa should be looked towards the kapha dosha, and for the treatment of kapha dosha, shighram ullikhet, it should be considered for vamana. It can be sadyovamana avastha, which is to be considered. Shula anaha vibandheshu gulme vataka folmane vartayoho gutikaschurnam kafavata haram hitam. That is about urdhvaka, that is jathara and above related organs and their symptoms. Now, if the pakvashagata lakshana in case of vataja gulma and kapha prakopa are seen, then shula, anaha, vibandha are the lakshanas which are seen. Gulme vataka folbane, in such condition vartayoho gutika churnam kafavata haram hitam. Kafavata hara varti and gutika, any type of kafavata hara gutika, yatha lashonadivati kafavata haram. Such dravya, hingu vachadi gulika kafavata haram. So such dravya should be made use in case of treatment of such upadrava caused due to vruddha kapha. Pittam va yadi samvruddham santapam vata gulminaha. If vataja gulma is associated with pitta lakshana, then there will be santapadi avastha can be seen. Kuryad virechyaha sa bhavet. So for pitta, chikitsa is virechana. It's again a sadyo virechana which can be performed. Bhavet sasneha sasnehaihi sasnehai anulomikaihi. Sasnehayukta virechana. Snehayukta virechana, that means trivrtadi can be utilized, or taila rupi virechana dravya, yatha tuvaraka taila can be made use, or patoladi sa dravya sadhita taila can be given. Nimbamrita eranda taila can be given for virechana artha, and that will relieve the pitta dosha, and kevala vata avastha comes. Then again snehana and other chikitsa they are running. Gulme yad daniladinam kratehe samyak bhishakjite na prashamyanti raktasya so avasekat prashamyati. Gulme yad aniladinam krate samyak jite. So in case of vataja gulma associated with pitta and kapha, these are the chikitsa principles, that is virechana, vamana, etc. But if there is the involvement of rakta, then rakta mukshana chikitsa should be na prashamyanti raktasya so avasekat prashamyati. If they are not subsiding by any means, that there is the involvement of rakta dosha, and hence in such avastha rakta mokshana can be the ideal line of treatment. That is what Granthakara says. So this is about today's session regarding chikitsa of vataja gulma and anubandhi dosha, that is kapha, pitta as well as rakta. We'll see in the evening about pittaja gulma and its chikitsa, and we'll try to finish chikitsa prakarana up to aushadha yoga in the evening session. Please join at the evening. Thank you.